name is Vaneet.
I'm part of business team at Practo, and today I'll help facilitate this conversation. So we are here today to discuss how to go about creating a successful telehealth network and how telemedicine is absolutely revolutionizing the Indian healthcare ecosystem. So we have a tremendous, amazing panel today. So without much further ado, let us invite our esteemed guests onto stage. So it's my pleasure and honor to host first of our panelists. This gentleman is a renowned entrepreneur and is a live example of hard work and sheer will taking you places. Having worked his way up from his research scientist days, he's founded a company that is today worth more than 3,000 crores. He's considered to be an infectious motivator and a master storyteller. Ladies and gentlemen, all of us heard his story in the morning. So please join me in welcoming Dr. Velumani, Chairman, Managing Director and CEO of Thyrocare. Dr. Velumani. Thank you, sir. Our second panelist of the day, Dr. Raman Kumar, is somebody who's credited with encouraging many young doctors to pursue a vocation in family medicine. He's founder and president of AFPI and has emerged a strong and vocal proponent for academic family medicine. He's also the editor-in-chief of the Journal of Family Medicine and Primary Care, is an executive member of WONCA, and has received several prestigious awards, including the Healthcare Leadership Award India in 2012 and Montagut Global Scholar Award 2013, awarded to him by American Board of Family Medicine. Please join me in welcoming Dr. Kumar onto stage. Doctor. Our next panelist of the day, Dr. Vinod Mittal. He's a senior consultant of dermatology at the Delhi Heart and Lung Institute and carries 25 years of experience with him. His interest in field of dermatology has culminated with him becoming the chairman of RSSDI. Dr. Mittal's educational qualifications are varied with an MBBS and an MD from Maulana Azad Medical College, as well as a postgraduate from the prestigious Johns Hopkins Institute. He's a senior visiting consultant at Gangaram Hospital. Ladies and gentlemen, please join me in welcoming Dr. Mittal onto stage. Dr. Mittal, you can come and join us, please. Our next panelist of the day, Dr. Siddarth Khera, is a renowned dermatologist. He graduated from the University College of Medical Sciences and followed this up with a diploma training from the VMMC and Safdarjung Hospital. Additionally, he has also acquired skills in aesthetic dermatology and laser surgery under the training of internationally acclaimed Dr. Nivat Polnikon from Thailand. Incidentally, Dr. Khera is also one of the very first beta users of paid online consult. So I'm sure he'll have a lot of insights to share with us today. Ladies and gentlemen, please welcome Dr. Siddarth Khera. Doctor, if you can come and join us, please. Our next panelist, Mrs. Seema Chandra, has been a prominent figure and a vocal proponent in food and health space for over 15 years now. She was the one who launched NDTV's food portal and then spearheaded to make sure that this website becomes the best in business, best of its class across the entire country. So she is editor NDTV for all the health initiatives, and she is also the managing director of Smart Cook, an e-commerce portal focused on healthy products. Earlier in her career, she was a researcher with India Today's magazine News Track and laid the groundwork for food and wellness research in India before she launched a slew of TV shows which took TV by storm. Mrs. Chandra, if you can come and join us, please. Our last panelist of the day, Dhruv Gupta, is a serial tech entrepreneur. This man has launched three different companies in the last 1 decade and has sold 2 of them. He's an acclaimed author of a book on weight loss. And right now, he's the vice president business head at Practo, where he's building the next generation telemedicine and preventive healthcare businesses. So please join me in welcoming Dhruv onto stage. Dhruv, if you can come and join us, please. If you can have a loud round of applause for our panelists. So thank you for joining us today. So as we all know, we are here to discuss how to go about creating a successful telehealth network and how telemedicine is revolutionizing the Indian healthcare. So I thought that maybe it would be a good idea to kickstart this discussion by spending a minute each and get your thoughts on how you see telemedicine going forward next 3 to 4 years. Seema, maybe we can start with you.
So having been in the health, wellness and digital space, I can say this, that I think India is very well poised for this. And one of the reasons for that is that privacy issues really, from whatever we've seen in NDTV at the food portal, are not a big concern. Indians are quite at ease sharing their health data. I think, in our case, I guess a brand like NDTV may help, where they feel the trust factor is pretty high. But we've noticed that even if it's come to something as simple as an online diet plan, patients are very, very happy to come on board and share with everybody digitally whatever their health concerns have been, their histories. So I think in that sense, it's poised for, a lot of success in the future. Of course, there are many questions attached to, what does it do to, and I'm sure doctors here will be in a better position to answer. What about the, face-to-face interaction? What about clinically examining? The other area I'd just quickly like to say is, we've all spoken and heard earlier about what Practo is doing in terms of collecting data and making the patient and doctor interaction far more useful. But the one area I think, again, where digitally things could go in telemedicine way ahead is in collating data. Mm-hmm. In collating data to figure out what are the kinds of infections, diseases, and what do you do with that data? I'm not sure anyone's got into that. If they have, great. But I think that's an area that requires a lot of thought. What do you do with the data that you have?
Awesome. Thank you. Dr. Khera.
Yeah. I totally agree with what ma'am said. And I am a new user for telemedicine. It's the first time, just a 1-month experience. And I can tell you it's a lot of scope. A lot of people who are in far areas, they are putting their queries and we are able to satisfy them. And the best thing is they give feedback. And when we see so many people who are coming by online, taking consultation is as easy as coming to your mobile phone. And just in 5 minutes or 10 minutes time, you in the window and you select a doctor and it's available. So like it's a fantastic opportunity going forward.
So glad to hear your positive experience. Thank you. Dr. Mittal.
Telemedicine, according to me, is already playing a major role. It's been there for a couple of years. And I'm into diabetes. So in diabetes, if we take India, it's a huge problem. It's a global health challenge. And India, we have almost 69 million cases. Next to China, which has got almost 100 million. And and it's growing at a very, very rapid pace. The problem is that gap which used to be there in rural and urban, the prevalence, now that gap is getting narrowed down. The prevalence is almost same in rural as well as urban area. So what I want to convey that in rural areas still we are deficient in health care system. The doctors, the accessibility, awareness, patients are very, very unaware about the disease itself. And like that is creating problem because a lot of people are unaware of the disease. They have diabetes, they don't know, and they present to hospital with a complication, heart attack or a stroke or a kidney failure, and this is the first time they come to know they have diabetes. The second is accessibility. These people cannot go to tertiary care, and then obviously affordability. So telemedicine is going to bridge this. Awareness can be improved. Affordability would be much less compared to in-person consultation, and definitely accessibility. They cannot go, so it can be done on the net. So this is very, very important, and I think in diabetes, screening programs can be started with telemedicine. We can diagnose more and more patients in a very, very early stage, maybe in a stage of pre-diabetes, and we can prevent these patients from going on to have diabetes. So that's very important, and patients who are having diabetes, we can prevent complications of diabetes in these patients, because timely treatment is very, very important. And patients who have complications, we can reduce the mortality. So I'm sure, we can, curb this prevalence of diabetes with the help of telemedicine, especially in rural areas.
Thank you.
Yeah.
Thank you. Dr. Kumar.
We all have to agree that technology is impacting all our lives in a huge, huge way, more so in the recent decade, last 4 or 5 years especially. And I would say telemedicine, the traditional which we focus on the hospital and rural remote area context, but more so in the recent times, I would say it is going to be use of appropriate technology as well as managing the relationships. Drawing from experience, I have started working with my colleagues in the suburbs of Delhi on a family practice in the Crossing Republic Noida Extension area. And we have launched a helpline, medical helpline 24/7 for our patients. So I was looking for a phone device to temporarily support this helpline for a longer battery life, and I found this phone, which is not very smart. It's not a smartphone, but its battery can last for several weeks. And strangely, I also found a USB port which can support mosquito repellent device. So it also functions as kind of mosquito repellents and prevention from dengue and chikungunya. So it's not a smartphone, but it is a useful phone. So when we talk about technology, it's not necessarily the best, the most advanced, the recent, but it is also the use of appropriate technology. And secondly, all our human behavior relationships are changing because of this intrusion of technology, be it within the family communications with the spouses, wife and girlfriend communications. So definitely this relationship between doctor and patient is also going to be impacted, and we cannot keep aloof. We have to be coming forward, and there are boundaries, there are legalities, but we have to come forward. We have to break these barriers.
I agree. And I think this relationship will only get strengthened because of technology. Like, yes, it's changing every single aspect of our life. And I'm pretty excited about your experiences and your insights. Dr. Velumani.
I think recent announcement of Reliance Jio is a very important announcement when it comes to data grid. So far, we were having only voice grid. We started talking about telemedicine when 1G came, then 2G came, nothing came, 3G came. Even there in only metro cities, your YouTube runs without buffering. In other areas, it is not functioning. So we were talking only in telemedicine till today. I think actual telemedicine is likely to take off only from now onwards. So that's about connectivity. Data was truly not available adequate, especially to see face-to-face and talk without breaks. Nowadays, I see in a restaurant, a family of 4 members have come and ordered for the food, and they are not talking with each other. All of them are in the smartphone, which obviously tells you don't have to look at the face-to-face to talk. Probably they are talking in the WhatsApp in the phone, sitting across the table. So these are all a few things which says that this is going to rule. The next one is, I said preventive care and sick care. Acute illness and chronic illness, and he said diabetes is one thing. If you look at it, planned surgeries can be planned in any hospital. Emergency surgeries cannot be planned in that way. Acute care cannot truly be supported by telemedicine, but chronic care can. So if you look at it, we need to look at what will work and what will not work. And my opinion is, in another 10 years period, if last 20 years we have done only 1% or less than that, in another 10 years, it should be around 25% telemedicine. The rest will be conventional medicine.
Interesting insight. Thank you. Dhruv.
I completely agree with most of the views here, and just underlining what Dr. Velumani said, with the incoming, 4G with Reliance Jio and the availability of data in general, I think it's going to help us leapfrog. So just like Indians leapfrog from not having landlines to mobile phones, and then from not having broadband to having data on our mobile phones. Similarly, I think we potentially can see a leapfrog in health consultations as well. There's a lot of Indians who, if you look at the two Indias that we talked about, right? There's the rural India and the urban India. In rural India, we don't have access, right? And potentially data on our phones can give us access directly to doctors without actually visiting them. It could be the first step to doing that. And if you look at an urban India, most of us, being urban citizens, it's a lack of time that we land up skipping going to a doctor, and data and access to a doctor on our phone is actually a great first step to going and then visiting a doctor, whether it's in a clinic, hospital, or whichever way. So I think one is that we're sort of in this leapfrog phase that we may potentially see over the next few years. The other thing with chronic, I mean, there are different kinds of use cases that we're seeing. We're seeing this being used as sort of the first port of medical call, where patients, what they do is when they, so typically today we go and visit a doctor at the point where the discomfort crosses the amount of effort we need to make to go and see a doctor. But with the advent of telemedicine, what it allows us to do is get medical advice directly from a doctor while sitting at home or being in office or being in the car. And I think that's a massive leap for health in general, to be able to get advice beyond Google and actually not have to go see a doctor to start with. I don't think telemedicine will actually ever replace going and seeing a doctor, but it's sort of the first step of taking us in that direction.
Thank you. So Dr. Kumar, so I want to bring you into this conversation. So Dr. Mittal, Dr. Velumani, and Dhruv talked about how a lot of us are going to Google to research our symptoms, and a significant percentage of us actually self-medicate. So that potentially is a pretty bad medical behavior. So do you see, so I have two questions for you. So one, do you see telemedicine helping curbing this behavior? And second, what role do you see for telemedicine on the preventive side of the healthcare? So we talked about how diabetes actually goes unknown, right? So can we use telemedicine on the preventive side of the healthcare so that we catch things much before they actually happen?
I see role of telemedicine much, as I spoke earlier also, much beyond the hospitals and the rural remote setting thing. Research says, and it has proved right all over the world, that 90% of the healthcare encounters take place within community, which are not addressed till now in our industry. And our whole of our industry is so hospital-centric that even in the urban areas, people don't have access to medical care, proper medical care when they require it. So there are structures, these are barriers. So as you said, that self-medication. So if you look at the population of Delhi, 70% of the people don't have access to good healthcare maintenance, good primary care services, because it's all hospital-centric. So 90% business can be, it can be expanded if we have appropriate services, appropriate technology, appropriate platform to handle all these intricacies of, consultation patients. So if you have, some forum, some platform, some means to communicate with your doctors through technology, if not directly in person, definitely it is going to change the, health-seeking behavior of the community. So people are actually afraid of going these days in the hospital for smaller problems. So where do they go? They go to Google. So I see a huge role for telemedicine, and especially building upon the, pre-hospital care, healthcare maintenance, which is 90% of the healthcare encounters.
Got it. Dr. Mittal, so I want to get your thoughts on this. So you have been a renowned dermatologist, which is a chronic condition, and a lot of patient monitoring is required. So do you see technology playing a role there in remote monitoring, and would that really, so essentially, how much better can it get if telemedicine really comes into force? So your views on that, please.
As you rightly said, diabetes is a chronic disease, and it's a lifelong disease and incurable. We don't have any treatment, cure for this. So patient has to be on medications. And lots of patients, they go for self-medication and, medicines which are advertised in the newspaper or by people who claim that it is curable, you take for 2-3 months. telemedicine can play a very, very important role in making general public aware of the signs and symptoms, one. And secondly, the risk of self-medication. Because self-medication is not only a wrong medicine, it can cause even other dangerous complications. Because there are certain medications which are contraindicated, not to be taken in a particular patients, and patient doesn't know. Like obese people, we give different, for thin people different. If kidney problem is there, the certain medicines are not to be given. Medicine can only increase kidney problem. So awareness would be a very big, important benefit. Then accessibility. Patients don't go to doctor because they don't have time. I have so many executives, they start at 6 a.m. and they go back, reach home by 9 p.m. because 2 hours commuting. A lot of people go to Noida and Gurgaon, and it takes 2 hours, 1.5 to 2 hours. So 4 hours are spent in traveling, and then the rest of the day they are very, very busy. So for them also, it would be very, very accessible. They can send their reports, their profile, their weight, blood pressure, and other things. And then definitely it is affordable also to a large extent, because in-person treatment is always costlier. And the traveling expenses also would be. So overall, awareness, accessibility, affordability, everything would be much better with telemedicine.
Fully agree. Can't agree more. So Dr. Khera, I want to bring you into conversation. So you already have been a beta user of Practo Consult,
Yes.
right? And you have consulted with a lot of patients. So I wanted to get your thoughts on how telemedicine is being perceived with Indian customers. So what are the positives that they think about it, and any concerns that we have to solve going forward?
Yeah, I would like to share some details from my side also, as well as patient side. Accessibility is the key. So a lot of urban patients, as Dr. has said, they don't have time to come to the clinic, and so they are very happy with the telemedicine and they book an appointment. But when I am consulting them, there are 2-3 things. All of them, I'm being a dermatologist, so I tell them to share their pictures. And a lot of people, especially female clients, you understand, female patients, they have a lot of hesitation in sharing the picture. They are always asking me, sir, what will you do after the consultation is complete? Rather, in some cases, I have faced a hurdle that they don't want to upload their pictures, and I cannot examine them properly. Second thing is, since they don't know who they are talking to, they don't research the profile properly, they will keep doubting your ability. Whether you are a quack or somebody who has paid something to Practo and Practo has put them there. So it is your responsibility to tell ki, no, they are thoroughly verified doctors. We have gone to them. Lot of quacks also, people have this feeling ki whether I am right, asking a right question or not, sahi doctor ke paas ja rahe hain ki nahi ja rahe. Then they will ask ki whether we should follow your advice or not.
Got it.
So they have credibility issues with the telemedicine. As a first portal of line ki, okay, let's get a consultation done, but this thing is missing. And what I feel is, in the later stages, training the patients that prerequisite history form should be there. They should share their laboratory reports, if any previous treatments are there. That will be really helpful in building their confidence.
Got it.
Yeah.
So I think a very important point you made is that trust is of paramount importance,
Yes,
and any platform that
and
enables
sharing of
telemedicine.
pictures. Believe me, I'm a dermatologist. Everybody has to upload, and it's very difficult.
Yeah. So Seema, I want to bring you into conversation, right? So, and this is a very interesting insight. So on one side, Indians are probably more secure about sharing their data. And on second side, so when it comes to health, so there seems to be some hesitation. So do you see this changing as we move forward?
Yeah, I see it changing, and one of the things I want to mention is everybody's mentioned time and saying that, oh, people don't prefer telemedicine because everyone's short on time. I quite agree. But the one thing that everyone's missing here is, and as a mother of 2, I'll say it very clearly, is I would hesitate to go to a doctor if there's a problem today because of the risk of infection. Secondary infection, communicable diseases. I don't want to take my children to a hospital unless it's absolutely essential, because I feel, hey, if I Google, if I can call, if I can find online, or some way to get them to be okay, if it's symptomatic, whatever, I'd rather not take them, because there are hotbeds. Hospitals today have become a hotbed of infection, and that's becoming worse as time goes by. So that's number one. And number two, one point I'd quickly like to make is, all of you said that as doctors, it's great to interface with the patient when it comes to giving them medicinal advice, that is using technology. But what happens when there are lifestyle diseases And you need to take care of a patient in terms of telling them what nutrition should they have, what should they do with their exercise regimen. And I think that's where technology also helps. If doctors, they can't possibly have the time to do this on their own individually. So if you can partner, get people on who are already online, doing this sort of stuff, having this sort of information, I think that collaboration could be very useful going ahead. Because you've got to manage people, not just give them prescription medicines. So I think that could be an area of, looking ahead.
So effectively, even in doctor-patient relationship, this can be a very, very strong improvement.
Yeah, I think it would, as a patient, as a consumer, if I were to think of it, it's great that I not only get to know what medicine I have, but how do I manage my situation, say 3 months from now? That would be very helpful. And technology can help hugely.
Agreed, agreed. So Dr. Velu, so I want to bring you in. And you have spent a significant part of your life in villages, right? And that's one part where there's balance between, or there's a kind of imbalance between patients who need quality healthcare and providers who can provide that quality healthcare. If you compare that to urban India, research shows 70% of, and you rightly pointed that out in your talk as well, 70% of physicians are busy less than 50% of their time. So, wanted to get your thoughts on how telemedicine can, one, bridge this gap, probably make healthcare access democracy and accessible to everybody. And second, any specific case you see where telemedicine will be a very good fit?
I think we are talking about accidents before we are laying the roads. पहला road आता है, उसके बाद गाड़ी आता है, उसके बाद accident होता है, उसके बाद signal आता है, उसके बाद ठीक होता है. So telemedicine still सड़क नहीं बनी है. I don't see anybody where I can just log in and use as telemedicine as of today, though I'm a very powerful scientist. So we are still talking. I think a platform is very essential to set the service providers on one side, the consumers on the other side, and this platform should be able to seamlessly integrating all the stakeholders into it so that the consumer becomes a victim of today, how he is a victim of Android. I use the word victim, but actually Android also is people are using, but telemedicine also people will use. I think some independent platforms should come in. A provider has his own personal interest as well as insecurity. The customer has his own apprehensions as well as lack of trust. Then you make a platform, both of them come inside, and tomorrow they will become completely addicted to it, and it is a job of the platform creators. Currently, there are no platform creators, and if you want to create a platform of size, comfort, you need to invest less than $1 billion. Otherwise, you are only talking, and you are not impacting, and I think that is a challenge for people like Shashank to see how best we can, how fast we can do it. Number one. Number two, we are today having a country which spends less than 5% in preventive care. No country can claim it to be a powerful country or a developed country until it spends at least 50% in preventive care. Undiagnosed becomes acute in the last minute. Diagnosed earlier, it becomes chronic. It is preventable, reversible, you can freeze it there. So I have a reason to believe that preventive care is the most powerful domain which will contribute for the telemedicine. The chronic illness management will be a very powerful business, and I think it is supposed to be seen like that rather than sitting and worried about, before laying the road, about the accidents.
Got it. Dr. Kumar, so would love to get your response to that, especially on the preventive side.
Yes, the World Economic Forum report has, 2014 report, revealed that India is going to lose $5 trillion only because of NCDs, non-communicable diseases. So one way of doing business is, exploiting this situation of preventable diseases, non-communicable diseases, which is the, addressing the endpoints. And the other, you can flip it over and you can do, contribute to national GDP and economy by preventing these diseases. So this all $5 trillion is preventable by 2030.
Got it. So Dhruv, so you have been leading the revolution in India, so as to say, and like Dr. Velumani said, so you have been building the telemedicine platform for India, right? But if we look at some other countries, we look at China, Guahao, we look at US, Health App, Teladoc, there are already millions of questions that are being posted, millions of consultations that are happening. So as you went about studying them, so if you could share some insights from their business models, and if anything that's applicable to India.
I think there's a lot that we can learn from them. Starting with China, I mean, if you look at Guahao and Chunyu, some of the big platforms there which are doing up to 100,000 consultations a day. I mean, number one, it goes to show that there is a huge demand-supply mismatch, right? Which these platforms have helped bridge, and I think that's the biggest thing. So, I was just reading about this the other day that there was this author of this article is a prominent person in China. His wife had an acute pain in her abdominal area, and he had to wait about 6 hours before a doctor could actually see that person, right? See his wife, and platforms like Chunyu and Guahao actually help not just telemedicine, but even for hospitals to use this to be able to predict the kind of demand that they need, and as a result match the supply to that, right? So I think there's a lot that we can learn just from that. So I think number one is just matching demand and supply, being able to provide doctors where they are needed and when they are needed. I mean, even if at 4 a.m. Someone has a health problem, there are potentially doctors available at that time. They could be sitting in an emergency room and not being very productive at that point. So I think that's the most primary thing. In terms of models, I think there are multiple models, but just to start with, I mean, if you look at the basic model, it's a transactional-based model, saying that you pay for each consultation. And I think over time it moves to like a subscription model where it becomes more of a relationship. And I think that's an evolution that we will start seeing, especially in the chronic space, right? Where today we, for diabetics, there's data that they're supposed to go see a doctor every 3 months at least, right? But we know that they'll end up seeing a doctor every 6 to 9 months on average, right? And this is a big challenge, and it's not that they're doing it to save money. It's just that it's not in habit. But everyone has a phone, everyone has data, everyone uses WhatsApp to chat. They could potentially do that with a doctor. People are starting to use wearables. That data can automatically go to your doctor. If there's any anomaly, it's very easy for doctors to use that data to reach out to you. So I think there's a lot that we can do. I mean, and just if doing the basics itself will help us take a big leap forward.
Sure. So thank you. I think great point made. And I think just to wrap this up, right? So probably a fair consensus would be that, like Dr. Velumani said, so today it's probably 1%, but in 10 years it's going to be probably like 25%. So that just shows like how bright the future is for telemedicine. And so Dr. Mittal, of course, made a point about chronic conditions, and Dr. Khera shared his experience with like the first step towards the revolution that's waiting to happen. So I guess so I just hope that when it happens, it's inevitable to happen. It's going to be a major positive influence on Indian healthcare ecosystem, and the gap between haves and have-nots. So hopefully that will be bridged just because of this revolution. So I want to thank the incredible panel that we had today. So thank you for being part of this discussion. And more importantly, I think a lot of thanks from all of us for the incredible work that each of you is doing to drive healthcare forward. It's an honor having you here today. So many thanks. Thank you.